Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about gastritis. Let's start simple. When you say, "I have gastritis," what does that actually mean?
Gastritis means the lining of your stomach is inflamed and irritated. Your stomach normally has a protective coating. When that lining gets damaged or weakened, stomach acid can start burning it. That's gastritis. It can happen suddenly. That's acute gastritis. Or it can go on for a long time. That's chronic gastritis. Both are real.
So what causes that damage? Why do people get gastritis in the first place?
There are a few main causes. Number one, a bacteria called Helicobacter pylori. We just call it H. pylori. It lives in the stomach and can keep the stomach irritated. Over time, it can cause ulcers, and in some people, years later, it can increase stomach cancer risk if it's never treated. Number two, painkillers like NSAIDs, the common anti-inflammatory pills people take for headaches, back pain, joint pain. Those medicines can weaken the stomach's natural protection and let acid chew on the lining. That can cause gastritis and even ulcers. Number three, alcohol and smoking. Alcohol directly irritates the stomach lining. Smoking slows healing and pushes the stomach to make more acid. Put those together and the stomach can't repair. Other causes include severe physical stress, like being very sick or injured and in the ICU, bile reflux, where digestive fluid washes backward into the stomach, and some autoimmune conditions where the immune system attacks the stomach lining. And just to be clear, spicy food can make symptoms feel worse, but spicy food alone is usually not the true cause.
How do people with gastritis actually feel? What are the symptoms?
Some people feel nothing at all. That's common. But when you do feel it, typical symptoms are burning or aching pain in the upper middle stomach, bloating, feeling full very fast even after a small amount of food, nausea, sometimes vomiting, loss of appetite. Some people describe it like a gnawing or sour feeling that may get better or worse with eating. Now, I want to separate normal symptoms from red flag symptoms. Red flag is vomiting blood, vomiting something that looks like coffee grounds, or passing black tarry stool. Those can mean bleeding in the stomach. That is not wait and see. That is get urgent medical care today.
Let's talk diagnosis. If I tell you, "I think I have gastritis," what do you actually do to confirm it? Can you do that without putting a camera down my throat?
Yes, we often start without a scope. Step one is your story. We ask, where is the pain? When does it happen? Do you get nausea, vomiting, early fullness? Have you lost weight without trying? Do you use painkillers every day? Do you drink alcohol? That already gives big clues. Step two is labs. We may check your blood count to make sure you're not anemic. Why? Because slow stomach bleeding can drop your red blood cells. We may also check for any sign of blood loss in the stool. Step three, and this one is important, we test for H. pylori. H. pylori is one of the most common causes of chronic gastritis in the world. We can test for it with a stool antigen test or a breath test. Both are non-invasive. You don't need a scope for those. If it's positive, you need proper antibiotics plus stomach protection from a clinician. Do not try to treat H. pylori yourself with random antibiotics. The treatment is specific, and doing it wrong can make the bacteria harder to kill later.
So when do you actually need the camera, the endoscopy?
We use endoscopy when we're worried about something more serious or we need direct proof. An upper endoscopy is a thin, flexible camera that goes through the mouth down into the stomach. We can look at the lining, check for inflammation, see ulcers, see active bleeding, and take tiny biopsies. We usually do this if you have what we call alarm features. That means vomiting blood, black tar-like stool, anemia, unexplained weight loss, trouble swallowing, repeated vomiting that won't stop, or ongoing upper stomach pain that just won't settle. We're also more likely to do an endoscopy if you're older or the symptoms keep coming back even after standard treatment, because at that point, we do not want to miss an ulcer or rarely a stomach cancer.
Okay, let's say you find out I really do have gastritis. What's the plan? How do you treat it?
Treatment depends on the cause. If the cause is H. pylori, we treat that infection with a specific combination of antibiotics plus stomach protective medication. That helps the lining calm down, helps ulcers heal, and lowers long-term risk. Again, please don't try to guess this on your own. You need the right combo, the right dose, and the full course. If the cause is stomach acid irritation, we use acid-lowering therapy. The goal is simple: less acid hitting raw irritated tissue so the lining can repair. Your clinician will choose the right approach based on how severe it is and on your other health issues. If the cause is NSAIDs or alcohol, step 1 is to remove the irritant. We cut down or stop that painkiller if possible and find a safer plan. We cut back or stop alcohol and smoking to let the stomach heal. If the stomach lining is actually bleeding or you have an ulcer that's open and bleeding, now we are in urgent territory. That often needs hospital-level care. In that situation, endoscopy can actually stop the bleed at the source.
What are the real dangers if someone just ignores gastritis and keeps going?
Main risks: number 1, ulcers. An ulcer is basically an open sore in the stomach or the first part of the small intestine. That sore can bleed. That can show up as black stool, vomiting blood, or anemia. Number 2, bleeding emergency. Heavy stomach bleeding can make you dizzy, weak, or even pass out. That is not "I'll sleep it off." That is emergency care now. Number 3, long-term stomach changes. If you have long-term inflammation from H. pylori that never gets treated, that can increase stomach cancer risk in some people over years. It's not common, but it's real. That's one big reason we don't ignore persistent gastritis.
So prevention matters. Talk to me about lifestyle and daily habits. What can people actually do to protect their stomach lining?
We talk about 5 areas: food, alcohol and smoking, medicines, stress, and sleep. Food. Eat smaller, more frequent meals instead of giant, heavy meals. Chew slowly. Stay upright after you eat for at least 2 to 3 hours instead of lying flat. Avoid big, heavy meals right before bed. Pay attention to your personal triggers. Common symptom triggers include alcohol, spicy or fried food, high-fat fast food, very acidic sauces, carbonated drinks, coffee and energy drinks. Those don't always cause the gastritis, but they can flare it. Alcohol and smoking. Limit alcohol and ideally avoid it during a flare. Alcohol hits the stomach lining directly, smoking slows healing. Quitting smoking and cutting alcohol are 2 of the most powerful protect the lining moves. Medicines. Be careful with daily or high-dose anti-inflammatory pain pills unless a clinician told you it's needed and safe for you. These meds are a very common cause of gastritis and ulcers. If you're taking them all the time, talk to your clinician about safer options. Don't just live on those pills forever without a plan. Stress control. Stress doesn't invent gastritis by itself, but it can crank up stomach acid and tighten everything up. Gentle movement, breathing control, taking time to eat instead of swallowing fast can calm symptoms in some people. Sleep and night habits. Give the stomach a break overnight. Don't eat a huge meal and then lie flat. If you get burning up the throat at night, lifting the head of the bed a little or using a wedge pillow can help keep acid down. Try to keep a regular sleep schedule. Your stomach actually likes routine.
When is it watch it and adjust, and when is it go now?
Watch it is mild burning in the upper stomach, mild nausea, feeling full fast, normal colored stool, and you're otherwise stable. Go now is any of these: vomiting blood or something that looks like coffee grounds, black, tar-looking stool, sudden, severe stomach pain that does not ease, feeling weak, lightheaded, or like you might pass out, vomiting over and over and you can't keep anything down. Those are not home care situations. Those are get urgent medical care now.
Talk directly to the person who says, "It's just stomach irritation. I'll drink milk and sleep it off."
Please don't ignore stomach pain that keeps coming back. Vomiting, black stool, or unexplained weight loss. Just irritation can still bleed. Just irritation can still become an ulcer. And in a small number of people, long-term inflammation, especially from H. pylori, can lead to more serious disease later. The good news is most gastritis improves if you respect it early. Test and treat H. pylori when needed, stop the irritants, protect the lining, and give it time to heal.
Give me the short summary.
Gastritis means the stomach lining is inflamed. Major causes are H. pylori infection, overuse of certain painkillers, alcohol, smoking, and overall irritation from acid. We start with questions, blood tests, and non-invasive H. pylori testing. We save endoscopy, the camera, for red flags like bleeding, anemia, weight loss, persistent vomiting, or pain that won't settle. Treatment is based on the cause. Clear the infection if it's H. pylori, reduce acid under medical guidance, and remove things that are injuring the stomach lining. Complications include ulcers, bleeding, anemia, and rarely, but seriously, stomach cancer risk if you ignore long-term inflammation. Prevention is smaller meals, less alcohol, no smoking, careful use of daily painkillers, stress control, and good sleep habits like not eating heavy right before bed and not lying flat immediately after eating.
Thank you, Doctor. And thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Your health is your wealth. Stay tuned for the next doctor tip you can trust.
Medical education only. This video is not personal medical advice. If you think you're having an emergency, please seek medical care immediately.